Hello again, Paul Perito from Coral Gables, Florida, MTP number 37. And this is something that we've kind of gone over before, and we talk a lot about penis size because that happens to be one of the biggest bugaboos when it comes to a penile implant. And like I've told you in the past, there's still people out there that say the penile implant makes penis shorter. And I keep reiterating that the only thing that makes a penis shorter is erectile dysfunction. The penile implant is actually the only treatment that will stop atrophy of the penis. And if you exercise it and use it as much as you possibly can, you will almost certainly see some increase in both length and girth with your penile implantation. So how do we size a guy? And I think it was 2008. And I was having patients come back to my office and they're like, "Doc, what'd you do with my penis?" And I would be like, "I didn't give anything to the guy next to you. I sized it to the maximum I could possibly size your penis." So we did a real simple study where we just looked at something called the penile stretch length, where you pull the penis as hard as you can. So get in your shower, pull it as hard as you possibly can, measure from your pubic bone to the ring, the glands, the ring around the glands, the corona. Not to the tip of it, because you can get swelling in the glands if you happen to have an erection, which is not penile implant length. But if you did that penile stretch test, then you did an artificial erection. In other words, you filled the penis completely with saline instead of blood, and you created a real erection for the guy that day. And then you took him to the operating room and you put the penile implant in and you measured that also. Guess what? All three measurements are identical. So in other words, whatever you bring to the operating room is what you're going to have that day. Now, if you wait another year to get your penile implant, you will have ongoing atrophy. And we've talked about that before. It's called corporal hypoxy. You don't have enough oxygen that gets into the penis because you're not having nocturnal erections, and things start to shrink in both length and girth. So when we size people, we do that penile stretch. We do an artificial erection at the beginning of our case, so we have a good idea, and then we push it. Now, how far do you push it? You don't want to grossly oversize your implants, and most serious implanters are gently oversizing. I call it right sizing the penile implant. The reality is an implant is a tissue expanding device, so no matter how you really size it, as long as it's not undersized and you use it, let's say you had to take it out a few years later, you're always going to be able to upsize your penile implant. Not that I'm advising you to take them out just to upsize. Continue exercising your penis and you will see increases in length and girth. So but the reality is, if we do an artificial erection at the time of your procedure, we know what you got. And then we push it a little bit, half a centimeter, a centimeter. If you grossly oversize, you'll get some defects with your cylinders. You can have what we call priapismic pain, where the implant's pushing on your your tissues. But most dedicated implanters are very good at sizing and gently oversizing and getting you to where it's the best that you can be on that day. So don't hesitate. If you're ready to get one, go get one. Excuse me. And that concludes MTP number 37. I'll see you next week.